Dr. Srushti from Shekar Eye Hospital. I'm a pediatric ophthalmologist and squint surgeon. Today I'm going to talk about amblyopia, which is in other words called as lazy eye. So amblyopia is a condition where the eye and all its microstructures are functioning normally, but still the patient is unable to see clearly through that eye. Why could this be? This is because the brain has adapted to see blurred vision through that eye since early childhood. So this can happen in conditions such as high refractive errors, wherein the brain has been trained to receive only blurred vision since the very young age. Or when there is a high difference between the refractive errors in each eye, wherein the brain receives a relatively clear image from the eye with a lesser power and relatively blurred image from the eye with a higher power, and it tends to get adapted to seeing with only the clearer eye. So the other reason could be misalignment of eyes, wherein the two eyes are supplying different images to the brain, and the brain prefers to see with either of the eyes. So whichever eye the brain prefers to see becomes a dominant eye, and the other eye gets suppressed, and vision development hampers in the suppressed eye since young age group. One more reason could be when there is a blockage of visual impulses reaching the brain through one particular eye, like in conditions such as congenital cataract, droopy eyes wherein the eyelid is covering the central area of the eyeball, or even in corneal opacities. So it's highly important to treat these risk factors in a very young age so that amblyopia can be prevented and the brain develops receiving clear image throughout. Here in amblyopia, the prevention becomes really crucial because after amblyopia sets in, although it can be treated, it takes a really long time and quite a lot of effort to train the brain back to normal. So how do we treat amblyopia that has already set in? Firstly, we have to approach and treat the risk factors as I already told, like giving glasses to children with high refractive errors at early childhood, treating the squint either surgically or non-surgically, whichever is suitable, and even cataract surgery and ptosis surgery whenever required, etc. Secondly, as a second step, amblyopia has to be tackled. Commonly, we give patching therapy, which is a gold standard technique of treating amblyopia, wherein the good eye or the preferred eye is patched so that the brain has only option to see through the poor vision eye. That is how the brain gets trained to see through the amblyopic eye. Although this goes for a long time, it might take months to years to improve the vision. Apart from this, there are these newer advancements wherein there are vision therapies which can be either in-office therapies or home-based therapies in order to train the brain in case of amblyopias. And these newer advancements has additional benefit of improving not only vision in amblyopia but also a higher visual function like binocularity, which is nothing but ability to see with both eyes together, and even it improves stereopsis, which is nothing but 3D vision. So this 3D vision, although it can be managed without it in our routine life, it will be very important in children who aspire to take up some challenging professions like being a surgeon, being a pilot in aviation, or even something like speed racing. This stereoptic vision or 3D vision is helpful in making split-second decisions and in seeing very minute depth perceptions will be helpful with 3D vision. So it is important for them to perform better in their academics and curriculum. So all in all, with this video I would intend to spread awareness with respect to treatment of vision problems in early childhood so that children get to enjoy their beautiful world and also excel in academics with ease.